Hello, my name is Jennifer. I'm going to be your student nurse today. I'm going to do your physical assessment. I'm just going to start by washing my hands. Can you tell me what your name is?
Anna.
And what's your date of birth?
4/22/91.
And do you know why you're here today?
To get a physical assessment.
Okay. I'm going to start with your scalp. If you can just look down for me. I'm going to look for any lumps, lesions, or abnormal loss of hair. And that looks good. Go ahead and look back up at me. I'm going to check your facial symmetry. And that looks good. I'm going to start by checking cranial nerve number 7, your facial nerve. If you can just smile real big and puff out your cheeks. Okay. And now I'm going to check cranial nerve number 5, your trigeminal. If you'll just close your eyes and tell me when you feel this.
Yep.
Okay?
Yep.
Okay, that looks good. Now I'm going to check your eyes. We're going to check your pupils. Make sure they're equal and round. Make sure they're reactive to light. And then check for accommodation. If you'll look right here, and then look back at the wall, and then look right back here. That looks good. We already checked cranial nerve number 2, the optic nerve, with the Snellen chart, and your facial and your vision was 20/20, so that's good. We're going to move on to your nose. We're going to look in for your mucous membrane. Make sure it's pink and moist. Make sure you don't have a deviated septum. That looks good. Make sure there's no lesions. We're going to check your symmetry. If you'll flare your nostrils, they flare symmetrically. Now we're going to check for patency. If you'll sniff, there's no blockage. That's good. Now we're going to move to your mouth. We're going to check your lips. Make sure they're pink and moist. Make sure there's no lesions. If you'll open. We're going to check your buccal membrane. Make sure it's pink and moist. We're going to check your teeth. Make sure they're white and aligned. We're going to check your tongue. Make sure there's no lesions. Make sure there's no discoloration. Check your gums. Make sure there's no white spots. Then I'm going to check your uvula. If you'll say ah, make sure it's not deviated. That looks good. Now I'm going to move to your ears. I'm going to pull on your auricles. Tell me if you have any pain. I'm going to push on your tragus. Tell me if you have any pain. Okay. Now we're going to check cranial nerve number 8, the acoustic nerve. If you'll put one finger in your ear, and I'm going to whisper, and you tell me what I say.
2, 4, 6.
Okay, and the other?
ABC.
Okay, that sounds good. Next we're going to check your spinal accessory nerve. If you'll push up, okay, and push against my hand, and push against this hand. Okay, that's good. Now we're going to move on to your neck. Check your trachea, make sure it's midline to the body. I'm going to check your thyroid gland, make sure it's not swollen. Then I'm going to listen, I'm going to auscultate and make sure you don't have a carotid bruit. Going to check on both sides. Okay, you don't have a carotid bruit, but if you did, it would mean that your blood vessels were narrowing or blocked. Okay, and then we're going to move on to your anterior thorax respiratory system. First, I'm just going to inspect and palpate, make sure you don't have a fever, make sure there's no accessory muscle use, and make sure that your chest rises and falls symmetrically. If you'll take a deep breath. Okay, now I'm just going to auscultate your lung fields. Check for any rhonchi or crackling. Okay, lung sounds were clear. Do you do a monthly breast exam? You don't? Okay. You need to try to do one once a month. Try to pick the same day every month and do it then. You can do it laying down or you can do it in the shower. If you'll just copy my motions, I'll show you how to do it. Put your hand behind your head, and then you'll put your hand right here in the telespins or right underneath your armpit. Go all the way around, work your way inward, and then you'll squeeze your nipple. If you have any discharge or if you have any pain, you just need to contact your physician to get a more thorough examination. Okay, and now we're going to move on to the anterior thorax cardiac section. I'm just going to inspect and palpate for any visible pulsations. I don't see any. Now we're going to auscultate the valves. I'm going to start in the second right intercostal space. And it's your aortic valve. Second left intercostal space is the pulmonic. Third intercostal space is Erb's point. Fourth intercostal space is the tricuspid. And fifth intercostal space is the mitral valve. And I didn't hear any any dysrhythmia. And then I'm going to check your apical pulse, which is also in your 5th intercostal space. Okay, and that sounds good. Next I'm going to also your heart is in between your 2nd and your 5th left intercostal space. Okay, next I'm going to check your posterior thorax. Let's turn. Okay, I'm just looking for any kyphosis or scoliosis, and I don't see that. And now I'm just going to auscultate your lung fields. Okay, that looks good. Now I'm going to check your upper extremities. I'm going to start by looking for any edema, erythema, or lesions, and that looks good. Then I'm going to check for any excessive moisture, any temperature, and check your skin turgor, looking for tinting, and you don't have any of that. Then I'm going to check your radial pulse and your brachial pulse, and that looks good. I'm going to check for your capillary refills, and they blanched within 3 seconds, so that looks good. I'm going to check for any clubbing. That looks good. I'm going to check your range of motion, so if you'll just follow my movements. Abduction, flexion, extension, adduction, supination, and pronation. Okay, that looks good. Now let's do your strength test. If you'll turn and push against. Okay, push down. That looks good. Now I'm going to do your deep tendon reflex. Okay, we're going to do your brachial radialis, your bicep, and your tricep. Okay, that looks good. And now we're going to do your neurological sensation test. This is dull and this is sharp. Close your eyes and tell me what you feel. Dull. Sharp. Sharp. Dull. Okay, that looks good. Okay, now if you'll lay down, we're going to move on to your abdomen. First, if you'll just take a deep breath and hold it. Just going to make sure that it is smooth and symmetric, and it looks good. Now I'm going to auscultate your bowel sounds. Listening in each of the 4 quadrants for up to 5 minutes. Okay, that looks good. And your bowel sounds are categorized as hypoactive, hyperactive, audible, and absent. And yours were audible. Okay, and then I'm just going to palpate each of the 4 quadrants. Tell me if you have any pain. Good? Okay. Now we're going to move on to your lower extremities. I'm going to start by inspecting. Make sure there's no edema, erythema, or lesions, and that looks good. And then we're going to check your range of motion. We have flexion, and while you're in flexion, I'll check your popliteal pulse. We have extension, abduction, and adduction. That looks good. I'm going to check your dorsalis pedis pulse, your posterior tibial pulse, and your femoral pulse. That looks good. I'm going to check your colonus reflex, okay? And then I'm going to check your plantar reflex. I'm going to check your capillary refill, and that blanched within 3 seconds, so that's good. I'm going to check your neurological sensation. This is dull, this is sharp, and tell me what you feel. Dull, sharp, sharp, dull. Okay, that looks good. Okay. Oh, and then the strength test. If you'll push against my hands. Okay. Push. Okay. Good. Now go ahead and sit up. Okay, I'm going to do your patellar reflex. Okay, and then I'm going to do your Achilles reflex. And that's all.